Transcultural Care Part 4. Lesbian, gay, bisexual, transgendered, intersex population. This group is often overlooked. They experience significant disparities in health status and care. Their barriers are related to sexual identity, sexual behavior, and gender identity. Their most unique healthcare needs of this population go unmet within the national mainstream. This group tends to avoid or delay care or receive inappropriate or inferior care due to perceived or real homophobia by the healthcare provider or institutions. Nurses often have negative attitudes including fear, ignorance, and homophobia, which leads to obstacles. So let's make sure that you understand the importance of the sexual orientation. This is defined as the preferred choice of sexual or romantic partners of the genders of people to whom one is attracted to. There are three aspects of this: attraction, behavior, and identity. Attraction is that of the preferences. Behavior is the actual sexual behavior or activity with members of one sex or the other. And the identity is one's sense of self as a member or particular social group based upon a shared orientation. The common term heterosexual, homosexual, or bisexual. Gender identity reflects one's perception of self. It may or may not correspond to one's biological self. The nurse's role in care of the LGBT is to design and implement healthcare programs to meet the needs of the population, involve in advocating for population at local, regional, national, or international level. So here, when you address the biological determinants of health, again, you are concerned with the maturation of aging, but also the presence of any physical illness. This might be due to high-risk behaviors, their reluctance to seek care, so something is way out of control, any surgeries they may have had, or any immunities they may have had. When assessing the psychological determinants, keep in mind that gender identity disorder and gender dysphoria are added as psychiatric diagnosis. Mental illness is caused by minority stress, often seen low self-esteem and depression. And there's many societal discrimination to where then the patient suffers from post-traumatic stress disorder and then ultimately sometimes commits suicide. When assessing environmental determinants, look at the population density. This may affect the availability of support services. How would someone growing up with a sexual identity problem be treated in a rural area versus an urban area? Homophobia and heterosexism. Biphobia, transphobia, and heterosexism. Heterosexism is where all people are heterosexual and superior to the other sexual orientations. Transphobia is that fear of those that are going through transgender changes. And then biphobia, a fear of those that are bisexual. The nurse must be encouraging to reveal and discuss their experiences, provide emotional support and assistance in redressing discriminatory practices. Social relationships also impact when addressing the social determinants of health. Family interactions. Is the family accepting or rejecting the person? Adoption or foster parenting. They pose more difficulty than for straight couples. A second parent adoption. Is there informal care given? Don't recognize any rights of the same-sex partners. The nurse needs to assess the state and local policies and legislation related to adopting and fostering by LGBT families. They need to advocate for equitable treatment. This has also been helped much more now that the state has passed a law where same-sex marriages are now legal. Also to consider that are the socioeconomic status. Are they homeless? Many times they're homeless due to the experience that they've had being a homosexual or transgender person. There's a lot of stigma and rejection to it. It could be that they're unemployed or they're poverty. Violence and hate crimes. Are they experiencing intimate partner violence? What about their sexual practices and serosorting? Substance abuse and abuse. Other health-related behaviors. Are they injecting silicone oil? Do they self-inject non-prescription hormones? What is their HIV status? Significant barriers to healthcare that may lead people to forego healthcare unless it's absolutely necessary. State that it may be personal or structural. Personal barriers are enacted stigmas, the explicit behavior on the part of the healthcare provider, which they deny care, provisions, inadequate or verbal abuse. They feel the stigma. Awareness of the stigma will be enacted in particular situations or internalized. Structural, it's the institutional stigma. How supportive is the institution? Is healthcare discontinued based upon their sexual preference? Education for population is confined to discussion of HIV infections and STIs. From the Gay and Lesbian Medical Association, homophobia in medical practice is a reality. So how do we help? We create a welcoming environment. This includes relevant information and education materials. Have an open dialogue with the patient about their gender and identity expressions, sexual orientation, and/or sexual practices. Post the rainbow flag or the pink triangle or the unisex bathroom signs and other LGBT-friendly symbols. Visibly post a non-discrimination statement regarding all equal care is provided regardless of age, race, ethnicity, physical ability or attributes, religion, sexual orientation, or gender identity or expression. General guidelines for forms or discussions. Intake forms should use relationship status instead of marital status. Use partner in addition to spouse and/or husband or wife. Add transgender option to the male or female checkboxes. Prepare now to treat the transgender patient. Ignorance, surprise, or discomfort may alienate patients and result in lower quality or inappropriate care. Develop trust. This may take longer than other patients due to traumatic experiences. Explain why the information is needed. Discuss health issues openly. Non-judgmental questions about sex practices and behaviors are more important than asking about sexual orientation or gender identity or expression. Specific issues. Conduct mental health and depression screenings as appropriate. You will see this as an increase in these health and depression. Ask violent screening questions in a gender-neutral way. Avoid gay term even if they've informed you of the same-sex partner or the same transgender partner. Stay away from the derogatory terms of queer, dyke, fag. When caring for lesbian or bisexual women, risk factors that they encounter are homophobia and stigma are based upon their sexual orientation and gender expression. They avoid and underutilize medical care, mostly because they have a lack of insurance, they're overweight or obese, they have a higher incidence of smoking and substance abuse, and lower rates of pregnancy. When caring for the gay men and bisexual men, the stigma is much stronger and affects more of the socioeconomic status. Again, they have a lack of health insurance, and there's more of a homophobic and harassment based on sexual orientation. Their culture norms are not there, and there's some false assumptions. Healthy People 2020 has something that focuses specifically on transgendered. I encourage you to go and look at that. Something to keep in mind. If you are neutral in situations of injustice, you have chosen the side of the oppressor. If an elephant has its foot on the tail of a mouse and you say you are neutral, the mouse will not appreciate your neutrality. This is a quote by Archbishop Desmond Tutu.